could be a ligament, a tendon repair. Sorry. Yeah. But going by what is most commonly seen,
But yeah, because it's not asking you for a specific diagnosis; it's asking you what's going on in the scenario.
Yes.
Right.
Yeah.
Yeah.
I think we're, as clinicians, we are so sort of almost diagnostic focused. Where,
sometimes we can be.
you
Sometimes we can be, but
yeah.
it's not always good to be, is it?
Yeah. I mean, we recently discovered you. I mean, it's a great saying, isn't it? Not we recently discovered. We practice this every day, but it's a great saying. You don't treat the X-ray; you treat the patient.
Yes. Aww. Yes. You don't treat the diagnosis. You treat the patient.
Yeah.
Very good. Yeah. Absolutely correct. Person-centered care here.